Welcome to the Public Sector Technology Exchange. I'm your host, James Baker. It's my privilege here today to have one of the great leaders in government, Carolyn Lawson. Carolyn, thank you for coming.
You're welcome. Thank you very much for having me.
Before we get started with our interview, I'd like to read a brief background on Carolyn. Carolyn was recently accepted a new position as the Chief Information Officer for the Oregon Health Authority. Prior to this, Carolyn was the Deputy Director for the State of California's Technology Services Governance Division. She also served as Director of the E-Services Office. She is a thoughtful leader and innovator. She's pioneered such things as crowdsourcing and cloud computing here in the state of California. She's been described as one of the most highly respected and unconventional leaders in government. As a winner of the prestigious Information Week 500 Award, she is considered an industry leader in both the public and private sectors. She was named by Information Week as one of the top 10 innovators in government in 2009. Carolyn, I'd like to spend some time today talking about some of the accomplishments that you've had here in California. There are numerous stories of how you've leveraged social media, how you've dealt with the issue of having less but needing to do more in government. If you could share some of that here with our audience.
Absolutely. One of my favorite things that I've been able to do is to work with the E-Services Office and serve as its director for a short period of time. And that office is unique in that the focus has been on the webmasters themselves. What the E-Services Office does is it manages all things ca.gov. So instead of coming with the big club saying, here's the mandate, you must do this, we don't care if you have no money. What we did is we went to the webmasters and said, how do we do this? How do we pull this off? We know this is a mandate. What happened was we started with about 25 angry webmasters in, I think it was October 2006. By December of 2006, we had 350 webmasters in the webmaster user group.
And that was a monthly meeting that you had together where...
In the beginning, it was actually bi-weekly, and it ended up being monthly. And what we did is we said, we have a mandate for a new look and feel. We have to meet the accessibility standards. We have to do this list of things that were given to us by the CIO. And instead of us making the decisions and telling you how, telling you what you're going to do, you tell us what we need to do.
And there's some wonderful stories in the state. And one of the examples that comes to mind is EDD with their call center, where they were able to leverage, I believe it was Twitter or another social media venue, and just tell that story a little bit about the impact that that has. Because I think a lot of times people look at, oh, you get these techies, they're going to try to do all this stuff on the web. But this is, when you look at business models and business solutions, this had a real impact on the bottom line of a major operation here in our state.
Yeah, it was huge. It was huge. And what it came out of was our webmasters looking for anything that's free, any way to be able to communicate what we need to communicate, and thinking about it in business terms, not in terms of this is a cool little whizzy thing, or as the new eye candy or whatever for the web. But the EDD call center is being overwhelmed with calls because unemployment was rising in California at a very rapid rate. They went out to Twitter and created a Twitter account so that EDD folks could tweet out the instructions to how to do the certain things, and essentially answering the frequently asked questions that were coming into the call center. As the rate of unemployment rose, the call center's numbers actually stabilized, which I found very interesting. There's now over 10,000 followers on the EDD Twitter account. So one of the other interesting things that they did is they started looking at how do we get this out to more folks. Went out to Widgetbox, and we were showing a Widgetbox tool in one of our webmaster user groups. And they put together the Twitter account, the instructional videos that they have out on YouTube, and their press releases into a little widget. That widget has been placed on 6,000 other websites.
Wow. And
has had over 24 million impressions since its inception just a little over a year and a half ago. It's huge. It's huge.
Well, I think the print here for anyone listening is, again, no matter where you are in the country, the scenario is seeing there's a rising population that needs services.
Right.
Budgets, in most cases, are going down, and you got aggressive with the intellectual property that we had here in the state, the different user groups, and figured out a way to relieve an overwhelmed call system using some of the social media tools out there. And the stories go on and on and on. Well, I know that I'm, as a Californian, I'm sad to see you leave here because I know what a great job that you did in office, but you have an exciting new opportunity coming up in the state of Oregon as the CIO. And as many of us know, when you're looking, there's a crisis going on in the healthcare community right now. Mm-hmm. Many states are overwhelmed, again, with the rising demand of people that need services, the ability to provide that. There's so much around the security of electronic health mm-hmm. records to the chronic fraud, waste, and abuse that's hitting many of our Medicaid and Medicare systems. So you're leaving California with this unbelievable insight of how to use innovation and lever that. And you're going into a new post. What do you see as some of the challenges as you're getting ready to go into the state? And describe a little bit about what you'll be doing there.
Well, first of all, the Oregon Health Authority is a really interesting organization. Mm-hmm. It was birthed from the Department of Health, Oregon Department of Health, and then they merged together everything Health and Human Services. So it's end-to-end from child support all the way through the healthcare services, everything. And the Oregon Health Authority is a bridge organization that bridges the Oregon Health and Human Services plus everything else. So mm-hmm. we provide services. I'll be responsible for the technology for all things health and human services in the state of Oregon. That opens up some really interesting opportunities because as the landscape is changing mm-hmm. with the federal health reform, mm-hmm. we have opportunities to reach people in different ways and connect the information in different ways. So for example, if right now, if you're eligible for food stamps, you may not know you're eligible for some kind of health insurance or some other benefit. We're going to be working on an eligibility system that's like a wizard. So you can get on and figure out yourself. Or someone, a caregiver for you, or a counselor for you, or someone in one of the local offices can say, let me see what else you're eligible for. The other thing that we're working on too is because this is a new organization, the leadership of that organization is very visionary. And they're introducing lead into the entire organization, streamlining the way things are done. Their mantra is do the right thing for the right reasons. Mm-hmm. They've already done a lot of reorganization and redesign from a business perspective. They're looking to me to do some of the same types of things, retooling IT, to be a support for that business. So I'm really excited about the opportunity of creating a new organization from those pieces that already exist.
Well, one of the things I've enjoyed in knowing you is that, and I think this is a message for anyone in government, sometimes we hear, the issues, the bureaucracies constrain me, I can't do this, and we sit here with one of the best leaders in government, and she's even received awards for being unconventional. And I think one of the things that is, traveled your career through is that you're looking out of the box. You're looking at mm-hmm. leveraging ways to use technology to bring change ultimately to the citizen.
Right. Well, and my motto is you don't say we can't. You say we can if.
I like that.
And so if you learn the bureaucracy really, really well, you know how to tackle it. And it's not about going around or breaking rules, or it's about working within the system and understanding where you've got flex and where you don't, where the hard lines are and where the soft areas are, and being able to work around that. And then drawing on the talent of the people around you. Because the people around me are the ones who've really done all these things. All I did was clear pathways.
Well, and I think as we get ready to wrap up, those are words to live by. We can if. And Carolyn, on behalf of the Public Sector Technology Exchange, I want to wish you success, happiness, and wisdom as you go out to Oregon. You'll be surely missed here in California, but want to wish you all the best. And for those of you that are interested in learning more about the Public Sector Technology Exchange, please visit us on the web at www.publicsectortechnologyexchange.com. I'm James Baker. Thanks again for listening to this interview with Carolyn Lawson.